Are the results long-lasting in a Brazilian butt lift? Yes, both the liposuction results and the fat transfer results are long-lasting. The liposuction results are long-lasting because you've permanently removed fat cells and you can't grow new fat cells. So if I've removed 50 to 60, upwards of 80% of the fat cells from a body area, they're not coming back. What that means is if you gain some weight, you're going to gain weight. Say I take 80% of the fat cells out of your hips, you're going to gain volume there at 1/5 the rate you would have had in the past because you only have 20% of your fat cells left. So yes, the results are long-lasting with regard to the liposuction portion of the procedure. With regard to the fat grafting portion of the procedure, there's the initial results after 3 to 4 months, and then the results going on years. Let's tackle each one of these individually. When we transfer fat to the buttock, there's an initial result that in most cases is 30, maybe 40% over the result the patient's looking for upon healing. Why do we do this? Twofold. Number one, when we're transferring the fat, there's upwards of 20, 30, 40% water content surrounding the fat that we inject that gets absorbed over the next day after the fat transfer procedure has been completed. So right out of the gate, you're going to lose a little bit of volume just because of that. Then there's the healing portion of the procedure. There's 3 destinies for the fat that we transfer into your bottom. The first is there's a very small amount of the fat that just takes right away. It initially is taken and you don't have to worry about it. There's another, about 25% or so of the fat that's going to just die and not be taken, and your body will absorb it and it'll be flushed through your liver and it'll be gone. What that leaves is that 70%. That 70% of fat sort of fades away slowly and is replaced on a 1-to-1 basis with new fat cells. See, when we transfer fat, we actually transfer fat stem cells along with this. And the fat transfer process actually stimulates those fat cells to grow upon being transferred into your new body area. And therefore, when I tell my patients what sort of result to expect, I tell them, 60% of what they see coming off the table, or maybe 50, 55% of what they see after the first week or so of that volume's going to take.